Hockey Helps the Homeless Durham region is here. Lace up your skates and join us on April 12th to support Blue Door, Durham Youth Services, and Backdoor Mission. Since 1996, Hockey Helps the Homeless has been leveraging Canada's love for hockey to raise awareness and funds for people experiencing homelessness. By signing up and fundraising, you'll enjoy some fantastic hockey action alongside hockey pros and support our most vulnerable neighbors. Whether you're a player, a fan, or someone who wants to make a difference, join us and together we can create a brighter future for Durham Region. For more details and to sign up to play, volunteer, or sponsor the Durham Region Tournament, visit hockeyhelpsthehomeless.com. Let's make a difference one goal at a time.
You're listening to On the Way Home with your host, Michael Braithwaite.
Welcome, friends, to another episode of On the Way Home. I'm your host, Michael Braithwaite. I have the absolute privilege and honor of working with the good folks at Blue Door, an organization north of Toronto, working in York, Durham, and Peel to support our most vulnerable in the areas of housing, health, and meaningful, well-paid employment. Check us out at bluedoor.ca and see the real heroes at Blue Door, the frontline team doing work, 150 people and growing, doing life-saving work there every day, from social enterprise work, getting people into living wage jobs to help build the housing we need, to getting them into dignified and affordable and safe housing. We have such an amazing panel today for this podcast. If you've heard of social medicine throughout your travels, in Toronto in November, new place opened up, Dunn House in Toronto, and it really around social medicine, and it really is bringing all the different pieces together. It's permanent housing for 51 people, healthcare connected to it, Fred Victor running the actual housing piece of it, UHN doing the hospital pieces, United Way stepping in, helping with that community development. And so we brought them all together to talk about this because it's incredible and innovative and impactful housing project that looks at things a little different in the services around people, working at health and housing together. So we have Keith Hambly, who's the CEO of Fred Victor, incredible guy. We've had him on before. Fred Victor is an organization in Toronto that just keeps growing and doing great work. Just in housing and homelessness and outreach. And so they're doing great work there, and they are running the housing piece of Dunn House. We have Nation Chuong on as well, who's a vice president at the United Way of Greater Toronto. Nation for years. And we hear about that on the pod, has been doing great work and kind of has its roots in community, in shelters, and really helping people. Just one of the nicest, most passionate, kindest people, and it's just brilliant too. The United Way was involved, and we have as well Dr. Andrew Boozary, who's been at this for so long and really always been pushing that, health is home, and so our housing is health, that kind of thing. And he talks about it, about the writing a prescription for housing, and it's not just that simple. We talk about how Dunn Street came about, kind of the origins of it, how did it happen, and all the different things that had to happen for things to fall into place, how the partners came about, why it matters, what the operating model is, how it's working, what they've heard, what their hopes are for the future for this. And of course, you want to do something like this, really show the impact that model can have and scale it across the country. And just so many, it's a long conversation. It's just so much, there's so much information in it. One of the key pieces I loved was when we were talking about so often, we're asked to kind of justify the economics of a housing project. And I asked Andrew about that, and he was talking about if we were to put a park in a community, no one would ever ask us to prove that, how that park is going to make money and pay for itself. Why is it when we put in housing for vulnerable people or healthcare, we're asked to kind of show the economics? And it's such a great point and well said. And three brilliant guys, hardworking people in the sector that have done something truly unique and different that we should be listening to in the sector, and gives us great hope for moving forward with different models of health and housing in the future. So without further ado, let's go to that conversation now. Keith, Nation, Andrew, thank you so much for taking time out of your busy schedule to join us today. So excited to talk to you about this amazing project that you are working on and is in progress. But before we get to that, we've got to start with the question that we ask everyone, because it's very personal and different for everyone involved. And that is, what does home mean to you? Now, I think Andrew and Keith have both had shots at this already. So they've already had practice being on before. So Nation, we're going to start with you and give you the first shot at this. Then we'll go to Keith and end with Andrew.
All right, I'll jump right into it. Immediately, I think the home for me is the smell of my mom's food. That's so incredibly grounding. And I didn't appreciate how significant food was in terms of a sense of place, a sense of culture, a sense of history and connection. And as I got older, I was like, yeah, all of that was so much a part of our experience as kids growing up. Home is vibrancy. Home is the place where you feel safe to be your full, complete self in all of its complexities and messiness. Home is the place in which you are loved and held accountable for your choices, your words, and your actions. Home is a place where you feel safe and you feel well, that when you put your head down to sleep, you can have a deep, meaningful, healing sleep. That's the ideal home. That is not the home for everybody in this world, but that to me is the ideal home. And when I've experienced home in its purest form or its full form, those are all the things. There's culture, there's history, there's relationship, there's love, there's growth, and there's a sense of safety and place.
Fantastic. Thank you.
How do you top that answer?
I was going to say we're all going to Nation's home, I think.
End the podcast now. Go ahead.
That's right. I think what home means to me, it's very similar. There's a comforting piece, and when Nation was talking about the smell of your parents' food and that sort of thing, those memories come back as you grow up in a home, as you grow in your home, if you will. And it's the comfort of the four walls and the ability to lock the door behind you, that there's a sense of security behind that. There's a sense of belonging, no matter where that home is, whether it's in an apartment building or in a rural area or in a standalone home. You're in a neighborhood, and I think that sense of belonging is a critical component for me. When I hear the word home, all those things conjure up: food, security, the ability to have friends over, the ability to connect with a neighbor. A good example this past weekend in our condo, that a guy who is starting his own baking business had a display or a little session on his baking, and I thought, where else can you get that sense of home and belonging? And again, the smells were amazing, but that sense of security, belonging, and the ability to and the comfort to go up to your own place, to lock the door behind you and say, I'm in my own place. And I think that, I'm sure this is where this is going, that carries through with all our work. I'm sure for Andrew, for Nation, for myself and you, Michael, that when we talk about home, we bring that to our work and all our abilities to work with the people that we work with.
You absolutely do. And it's interesting, Keith. I think for a long time, and I was part of the problem, we kind of messed up. You mentioned community, right? And it's more than the actual structure, where we put people in homes and not worry about the community, and then they'd be back in the shelter. Like, what are you doing back here, right? Because, okay, well, listen, when I was here, I had 25 buddies. The staff cared about me. I got food, right? And then you put me in an isolated space on my own and wondered, and I was lonely and miserable and no one cared. And so I'm back here. So then we're like, oh yeah, we got to build. It's not just about the home, it's about building community. So the aftercare and all that kind of stuff comes in, but it very much matters. So thank you. And thank you for the work that you continue to lead at Fred Victor. Andrew, what about yourself? What does home mean to you?
I mean, these are two such compelling answers from your friends on home. I mean, I think home is everything. I think about what Nation said about, my own mother's cooking and the smell. I mean, I think it's really about family, to your point about that connectedness. I think Keith said about, that feeling of belonging. where you can feel rooted, and I think that's really a big part for me. And I think, which we'll talk about with the work, I think it's the fundamental foundation for health and well-being and happiness. And it's really, without that sense of connection, of being rooted, of being secure, all these other things become much more challenging. So I think that kind of connection to place, but also family and people, is really what I think drives that sense of home versus or over housing.
Absolutely. I thought actually, and you mentioned it, but I thought you would be like, housing is health, and you just drop the mic. That was it.
I think this was an elaborate conversation. It's that and obviously much more, and I think you don't want to ever discount how important this is around home. And I think you didn't say housing, which I think was actually really important and purposeful. You talked about what does home mean, and I think there's a real distinction between homes and housing, and I think it's important to drive that home.
Well, the best best answer is subjective, but Fred Victor put on a T-shirt, "Home is love," right? I love that. Love. Simple, yeah. And that's Jesse Thistle, right? That's where right. I'm like, no, that makes sense.
Yep.
So great. And again, it's very personal. It's funny when you talk about cooking too, Nation. I think about my mom burning that smell of burning liver.
It's not all cooking, I guess.
But it does bring you back to home, no matter what. I remember that.
Mine's slightly different. I grew up at the corner of Victoria Park and Lawrence, just at the intersection of Scarborough and North York. There are two high rises there. They're legacy towers. Built in the 70s and 80s, funded by the federal government, and the home to a lot of working class, low income folks. But the thing about that resonates with Keith's comments is, I loved when my friends go, "Is your mom cooking? Are we coming over?" And so home is this place in which you can welcome people, and it's an expression of something you are proud of. And when you can bring folks in and create a sense of community and extend that playground community into your living room, it's a wonderful thing.
And that's such a connective tissue when we talk. I appreciate you opening with that question, what does home mean for you? It just unleashes all those both emotional and practical pieces around what home means for us personally and in our work. And when, because I know we're going to be linking us to Dunn, and you think Dunn is sort of that example of what home means for a community that has not had stable homes, if you will, for many, many years, or any stability in their life. And the three pillars, if you will, that Dunn has, in my opinion, is to your earlier point, housing is health. Well, there's home, it's health, it's food security. And, you have the three of us here that all bring those components under one roof in Parkdale. But for each of us in our own organizations, that permeates all our housing, that permeates all our shelters, all our community programming, the same with Nation and the same with Andrew at UHN. It really is the connective tissue that makes for a successful home. It's not just the four walls and a roof.
Absolutely. And well said, Keith. We want to talk, you guys have huge histories, so we could do another podcast on it. But I do just want, for listeners who may not be familiar, if you could just tell us kind of briefly how you ended up doing what you're doing now. And Andrew, we're going to start with you, and then we'll go to Keith and end with Nation.
Well, I think, a lot of it goes back, this conversation about home. I was born in St. Jamestown in social housing, and I think that's always been the rooting of the work, and knowing that, that really a lot of this is luck, and it shouldn't be, around the sort of policy choices that are made around who gets access to housing and who doesn't. And then really, I think, crediting health leaders, nurse leaders like Wendy Muckle and Jeff Turnbull in my first year of medical school, going right into this work, and never being able to shake it. It just was just right from the first week of medical school, and really fortunate and grateful to mentors like Jeff and Wendy and many others along the way, who've helped further my understanding and shape my thinking around housing and health.
Thank you for that. We've had, it was interesting. Dr. Turnbull, I think, was one of our first guests, and it's just amazing. Everything you said and more, just you're like, wow, this is how it's done. Keith, how about yourself?
Sure. I think the journey, if you will, I'm not going to go too far back, but my journey really started at Fred Victor as a frontline worker. And that goes back to the mid 90s. And I had lived in Ottawa for a while, went to school there. But the interesting thing that got me turned on to the housing aspect of it, of my work, was work coming right out of university. Managed a campaign or a political campaign for a city councillor, and he won. And one of the very first issues that came to us within a couple of days of us winning the election was an application for a housing expansion of for an organization that a group home in the ward. And the utter anger that produced by the neighbors was surprising, appalling, and unbelievable. When this organization was working with people with developmental issues in a group home, and they only wanted, I think, 3 extra spaces in a house, in which they had funding. And I thought, my good God, these are your neighbors, and it was a surprise to me in that way. And as I went forward with the work in the counselor's office, I started volunteering for a small, well, it wasn't even an organization. It was actually the beginnings of Bruce House, which was a supportive housing agency, eventually a supportive housing agency in Ottawa for people living with HIV and AIDS. And then I moved to Toronto and answered an ad and was a frontline housing worker at Fred Victor. And ironically, about a couple of weeks ago, I had lunch with the executive director from Fred Victor from 1988 to 94. And he was talking about his journey to Fred Victor, and very similar, that he was looking at housing, and that point he was with the ministry, United Church Ministry, and he was saying the very same thing, that people who are homeless, who are marginalized, not just need housing, but they need a home. Just getting back to your earlier question, and I thought, this is a home for me to do my work and what my passion is. And that's how I started at Fred Victor. And we could talk a little bit more how Fred Victor got involved with Dunn House through the Rapid Housing Initiative part of it. But I know Andrew has more background on how UHN got involved and the initial catalyst to get Dunn off the ground, and not to put up a parking lot, but to actually put up housing.
Very cool. And Keith, in the first time you were on the podcast, we said, because no one works harder than this guy, I'm telling you, Keith. And we said he was the Gene Hackman of housing and homelessness. Now, what I did is date myself and you, because people are like, who's Gene Hackman? So now we're going to update that reference.
Can you update that now?
Yeah, you're actually, I don't know if you like, but you're the Nicole Kidman of, you're everywhere. You're in everything. You do a great job everywhere you go. Awards follow, right? So thank you for that, Keith.
Thank you.
Nation.
Well, my career started mid-90s, much like Keith. I walked into the doors of a community organization in downtown East called Dixon Hall. It was a soup kitchen from the 1920s, and I had the great privilege to be mentored by a number of folks. My career has jumped across youth development to housing to back to youth development. And so I'll stick to the housing theme. One day, Dixon Hall is a multi-service agency, and so there's youth programs, there's senior programs, and then there is the homeless hostels and housing department. And there was this tenacious woman who was leading the department, Ellie Matcham. And one day, it was the end of work, and there was a gentleman stuck in the washroom in the basement, and he was intoxicated. He had urinated on himself, and everybody had gone. I'm like, what do we do? And Ellie had said to me, do you think you can help him get out of there? And I'm like, yeah, I can do that. His wheelchair is right there. We got him out, up into the elevator, and she said, he stays at the Seton House. Do you think you can take him to the Seton House? So she called a cab. I dropped him off, and I walked back from Seton House to Dixon Hall. And then Ellie, in all her grace, said, "Thank you. I think you should think about this type of work. I think you can do it." And at that time, I was doing mostly youth work. Fast forward, and I started to work at 60 Richmond Street Shelter, which was at the corner of Richmond and Church, under the amazing leadership of a gentleman named Bob Duff, who was leading that shelter. I also worked at the Elspeth Hayworth Shelter on Danforth. So those that formidable parts of my career, and it shaped my soul. I tell you, the deep submersion in humanity, when you're able to greet people who are coming out of inadequate mental health supports and trying to survive on the street, people who are being released from the criminal justice system, and they're trying to find just someplace warm and a warm meal, to be able to meet those people, not the stereotypes, but the people that walk in that door and want to sit down and just play dominoes or talk about whatever, and who, if you just extend an inch of kindness, will meet you in that same place, shaped how I understood the world I was living in profoundly. And that led to doing some case management with the Regent Park Community Health Center for Caribbean men with mental health and substance dependency. And again, deepened my knowledge and my understanding and appreciation for the struggles of humanity as I held the hand of elderly folks who were living in the shelter who passed away, or gentleman who was really struggling with crack cocaine addiction and had to just witness what he was willing to do to get his hit, and swallow that, and just meet him on my bicycle at the corner of Sherburne and Queen and say, "Are you okay?" And then walk away with tears in my eyes because there was nothing I could do. This was beyond my control. So that was my first 9 years in this sector, was doing that type of work. And Dixon Hall opened up under Dixon Neighborhood Homes, the St. Lawrence House, the transitional housing. And so I was lucky to play a critical role to help folks leave 60 Richmond Street Shelter into transitional housing. It ended up being permanent housing because people were like, "I'm not going anywhere. I'm good." And they weren't transitioning, and it built relationships with March of Dimes. And so I started to understand the broader ecosystem of the housing universe. Fast forward, I joined United Way in 2006, and then I've had the great privilege to be in the company of incredible leaders like Keith and Andrew, folks at the City of Toronto, that's brought all that housing experience into something that is more than just frontline response. It's actually thinking about infrastructure and how we do cross-sector solutions to infrastructure.
It's interesting, Nation, when you were talking about just your trajectory as well, just how many people probably crossed both our paths in that time period. It's Bob Duff's of the world and whatnot. And something struck me around what you were saying around those connection pieces, and I often refer back to when I was frontline, working in housing and doing those 12-hour overnight shifts. Ironically, those shifts were the shifts that I connected most with, probably the most marginalized, most isolated people, even in our housing. And when you say playing dominoes, but I remember playing cribbage at 3 a.m. with about four guys who lived in housing, and that was the best connection because you never saw them during the day. They called them night owls. They only came out at night, and that was the only connection they had. And I thought, wow, this is amazing that you could make this small gesture, and that had meaning in their lives. It certainly had meaning in my thought on how I work with individuals in this community, and it has stuck with me ever since.
Well, I think both of you have done something that is not like rocket science, right? You treated them like human beings, right? You actually humanized, and it wasn't social service. It was just being kind, right? And moving forward. It's funny. I would love to do at some point a podcast around transitional housing. The more I've been in this, the more I'm thinking, is transitional housing just bullshit in a sense that we don't have longer term housing, so we call it that so we can justify the dollars to get people through? Because honestly, I think in most transitional places and in Nation, the Region of York built one. We operate Passage House. You get a brand new, beautiful apartment for $300 a month for a year. Now I'm going to move you to probably a room in a not beautiful place. And like, so what's my, what is it really? So it's dignified for a year and then not. And often I remember even in youth services, and again, I'm going way off base, but in youth services, I remember talking to a group, and I won't say who, and they said they had transitional, they had shelter transition. I'm like, where do they transition to? And the staff, they're like, back to the shelter. And it wasn't, just this circle of like, well, what's the whole point? Like, it is not their fault, because we need, as you guys are doing, like, you need housing to go out to, but I don't know, it's transitional really built for organizations and not for the people in need, to serve the needs of funders in a sense.
It is a challenge. In some ways, some parts of transitional housing I like in terms of the levels of intensive support that could be provided, but in the end, where does the person go? So if you don't have good flow and good production of housing units at one end, people are going to be stuck in transitional. And as Nation said, the Dixon Hall experience is, well, transition just turned into permanent. We see that in shelters now, and Michael, you see that there too, where we have people who are in shelters, can't move out for a variety of reasons, and they rotate through 3 or 4 shelters. We see that ourselves.
Yeah, they're on the
Sorry,
same.
we're way off topic on your show.
Yeah. It's Sandra from the Calgary Drop-In. I remember her talking about when she went in there, and she had a gentleman that lived in that shelter for 30 years in shelter. And she said, and there's reasons why, like different things, but anyways, yeah, we're way off. Let's talk about Dunn House, because this is incredible, but this didn't happen overnight. So when say, hey, well, you guys should, I have an idea. Can we talk about the history of that? How did it come about? When did it, the idea come about? How did it happen? And what was the process? And I don't know who wants to start. I think
Andrew's best.
I think Andrew, that's yours.
Yeah, thanks, my 2 dear pals. We'll go back memory lane, and you'll edit and correct and revise, where of course need be. No, it's not overnight, and again, I think the journey on this, I think, speaks a lot to why I think it's been able to garner some traction. I think it really is about partnership, but really going back in 2019, a lot of this thinking was around going back to your first question, Michael, like, what do people need to be healthy? And I think the fundamental question that I tried to pose when being new to University Health Network and trying to understand the network better and the reach and the understanding of its mandate around being a university health network and not a university healthcare network. It's pretty clear, of course, from the data and the literature and the evidence that housing is one of the most powerful social determinants of health. When you looked at UHN data, there were about 230 patients that made up over 15,000 emergency department visits in 2018, 2019, many because they had nowhere else to go, but also, I think, which is going to be an important, theme of this conversation, is that people are getting sicker and sicker, and that the realities were that conditions that could have been treated upstream in someone's home that could be routine were becoming really complex and really detrimental to people's own health, but then also the acute care system and the pressure. There's just real mismatch. And so is thinking really, again, with where we've heard communities been wanting to see hospitals and healthcare institutions think differently, partner differently about the solutions that need to be in place that are real lasting solutions, as opposed to the Band-Aid solutions that many of my colleagues have to work and muster through, whether it's an emergency department, a primary care clinic, outpatient setting. The amount of moral distress, I think, was palpable then, and I think the challenging part when we're having this conversation is that it's seemingly even worse in the last 5 years when we've been having these conversations, coming through some really great work that Keith and Nation and so many have done through COVID and the pandemic to try to keep people alive. So the genesis of this was to really think differently from a social medicine perspective of what actually drives health, where that kind of work can be. And I think really to sort of fast forward, it's also to push it against the sort of usual hospital hubris, if you will, that hospitals and medicine know how to do things because we have some expertise in a certain area, then that can somehow be generalizable. But that was one thing that I think we really tried to do differently was, partnering with the city of Toronto that has expertise in housing policy, United Way from a community perspective around what the sort of social care and fundamental aspects need to be in place. And then, of course, no one would want the hospital as a landlord of where you have, Fred Victor as such a expert and skilled, nonprofit operator, but bringing so much around the housing expertise that have been in place. And so I think those are things. The other thing because we did go down that road of transitional housing, there have been models like this where hospitals, this is not the first time that hospitals in North America have been looking at housing options. But if you do a scan of the literature, a lot of them do transitional housing and say, well, we'll move you from the hospital ward or the emergency department for 90 days. And we've talked about this. It's far cheaper to keep people in housing than it is for a month in hospital, which is over $30,000 a month versus $4,000 a month in supportive housing, let alone some other housing options. But what became clear for me in working with our partners is that we didn't want this to be a hospital discharge exercise. We really wanted this to be homes. And that was part of the genesis, to have this as permanent housing for people, so that really there isn't this time clock when you're there of, you've been moved out of a bed, now you've got to get your life together in 90 days and figure out where you go next. Well, of course, the upshot is there is nowhere for people to go in the city of Toronto when that happens in 90 days. And so that's, I think, part of the Dunn House journey. And I think the thinking continuously being informed along the way as more and more partners have come together on this and adding more and more expertise to how we think about housing and health, and now actually how we deliver it, right? And that continues to be an iterative process here at Dunn House.
Amazing. And yeah, like all those pieces, I know we've talked with a physician in Edmonton that was talking about the transitional piece you talked about. He did that. And the pieces you talked about, I remember, Keith, I think you were there as well in Edmonton. I was at Dr. Sandy Bachman, who was talking about like all those different, like the life expectancy, and then talked about access, Andrew, like you talk about, it's not equal access. It just stuff that blew my mind. Wow, this is no wonder, all these different things that are happening. And we saw, even at Blue Door, what happened during the pandemic is we were running an isolation site. They attached a nurse, the isolation site, to triage when someone came in. Right. And the results were like great. Like, wow, they got treated so quickly. And then we were able to house them quicker. And we're like, well, why are we doing this for everyone? And then, of course, we hired it, but no one wanted to pay for it. And we still are not paying for it. The province isn't paying for the healthcare that we provide for clients. We do it through fundraising, and the region and others have stepped up. But just by adding a part-time nurse, we unfortunately have a lot of calls to EMS. Someone comes to the desk and says, I don't feel well, EMS, right? Police, ambulance, fire. And it is, traumatic for everyone involved and expensive. We cut that in half by just having a part-time nurse where they could check in, do routine tasks, that kind of stuff. So we saw that, see the value and the cost savings, as you said. Now, if I understand right, Dunn Street was a parking lot the city of Toronto owned. Is that how? And how did discussions begin around that? No,
so it's UHN owned property. Actually, again, talking about, I think, parts of it that I think are innovative again is around the partnership. Is that. And again, lots of people deserve credit, especially our chief legal officer, Mark Toppings. I have to shout out that really working through and trying to figure out the right configuration to unlock more investment and opportunity for people is that, and then, the UHN board and CEO to have the belief to say, we're going to donate or essentially lease the parking lot for 49 years for $1. So it's actually not a donation, it's a lease, but it was really for $1 over 49 years technically, to then allow the city of Toronto, to the city to be able to pull in rapid housing initiative dollars from the federal government and the provincial government from a healthcare perspective of supporting the initiative from Ontario Health. So it's really every level of government, and we've talked about the power of community, partnership with United Way and Fred Victor, but really every level of government to be able to make this investment with the lease transfer for $1 that I think unlocked a lot of this potential, thinking about that land differently and that space differently around the needs that were there in community that people have been calling for a really long time.
Yeah, that's incredible. And to get it done now, but from start to finish, it's all right, we're going to do this. The city leads that. And I remember reading about this project, and it took some time, right? I think this was announced, like the start of it was before COVID, right?
Well, I think the idea of this and then the commitment to it was before COVID. I think, of course,
Yeah.
the challenge is when you start to then start into moving into it with supply chain issues. I mean, COVID, of course, it turned everything upside down. But again, also real credit to the Housing Secretariat, with Abby Bond and Valessa Faria and folks to never quit on this really unique sort of approach to addressing this issue that, in many ways just was totally unconventional about the kind of partnership. And again, with a hospital partner to say, this is the land transfer, but here's also how we're going to work as partners to decide, where's your expertise on the selection of how we work together, of the housing pieces that need to come together with the architects, the design, the hospital and housing piece, the hospital piece, on the healthcare aspect of how to ensure those right supports are there, from nursing to primary care and some of the other wraparound models that need to be in place. So that kind of continued to co-create, and then have even further accelerated with United Way being there, thinking around some of this, and the community engagement with West Neighborhood House, but then really with Fred Victor, where this continues to be, I think, the real marriage of health and social care. Like that's what continues to, and we're having this podcast today, but yesterday I was in clinic at Dunn House, and maybe we should have had the podcast then later, but I mean, it continues to be surreal, right? To be there on the first floor in people's homes with them, where they can have access, but continuing to think and troubleshoot with the Fred Victor team on the ground of what can we be doing better, differently to support people, from how can they access their medications to what does the social connection look like with the local library for people on health. And that to me continues to just be the most compelling part of this initiative. And it continues to take life in different ways as more and more people get access to Dunn House and inform our way of thinking of what needs to be done.
Well, walk us through. That's a great segue into how does it work, right? So where do the clients come from? Who are you serving, and who does what, and how does it because this is an innovative and different model, right? And hopefully something that can be replicated. So for people to understand how it works, would love for someone to walk us through.
Yeah, I mean, we'll put out a playbook with Nation and Keith, I'm sure, soon. Because great to reach. And again, we're really, again, that's the other piece. The scale part, Mike will totally agree. 51 homes that Keith and I continue to be out there about is not going to end the homelessness crisis. But our real hope, and my hope from the beginning, has been that it can unlock and push other healthcare institutions, other public organizations to be thinking differently about their land and resources. And I think the other part that's unique in how this came together on the supportive housing front is that it's an integration of criteria. So it's how long people have been waiting for housing from an equity perspective. And I just have to also give full disclosure. There is no perfect algorithm for selection of patients or clients in a sea of inequity when people are waiting 8 to 10 years for housing. So, and for 51 homes, you're never going to have this perfect or right. And it is always going to be inequitable when there continues to be this much need and this much suffering of where people continue to be denied access to housing. But what was a first real push in this sort of data sharing, data integration was one on the equity front of how long people have been waiting for housing from the city data and the city wait list, as well as with the healthcare needs that people have and how complex they are. So it prioritizes both health needs for people who are having real challenges or needs coming through UHN, in particular Toronto Western and Toronto General, but also Toronto Rehab and other parts of the UHN family and umbrella, and really where there's the highest risk for people in terms of having worse health outcomes if they did not get access to housing. So that's how we really tried to pull that selection together, and then working very closely with the Fred Victor team, with community health workers, to be able to pull people these opportunities to work through all of the obstacles to get them into place and being housed as quickly as we did in November, and where people have moved in. And I think the other part I just have to say, because I know there's so much knowledge and expertise from Nation and Keith, I'll just say from a physician perspective, I totally get it. People love the idea of me writing a prescription for housing. Like I just look at the pad right now, I have a pen, and it's like, this is brilliant. Like, Dr. Boozary will just write housing and hand it to the patient. And like, this is amazing. And it's prescribing. But I have to be really adamant that it takes months of trust. It is not that simple. And what I think is really powerful about Dunn House is the partnerships around community of building trust with people. It's actually the community health workers and the navigators that really fill that prescription of being able to work together with the patient and client over many months to go through all of the administrative hurdles, all of the sludge, all of the rightful mistrust people have around healthcare institutions to move into housing, and then hear these incredible stories that people have been denied their own bed and bathroom for years, and what that feeling is for them to have their own agency. So I just have to be clear in that it is prescriptive housing, absolutely. It is social prescribing from a hospital perspective, but the real proof in this prescription is from the partnerships and trust that have to be built along the way, or rebuilt along the way.
Yeah, Michael, if I could just jump on there quickly. Another thing that I think is important to note in what made Dunn House what it is, just in addition to Andrew's point, I think part of the Rapid Housing Initiative criteria, and this is where policy is really important, I believe, and Andrew, correct me, articulated that it had to take an equity lens given the populations that were historically unhoused, dealing with complex issues, living in Parkdale. So we're talking about folks who are often of Indigenous heritage or of a racialized community, who are part of those most vulnerable. And I think that's noteworthy because you have the assets of UHN that has enabled the building of this building. You have the expertise of the city of Toronto. And when these things come together with policy that takes intentional focus on those folks who have been most marginalized, if you will, to just use a general parlance, I think you can then, it creates the recipe for really great intentional work for some of the most vulnerable folks in our community. One. Two, Andrew's mentioning the navigators. I think that is an integral part of the formula. 51 units, absolutely. What made me really inspired to be part of this work was when Andrew and Angela Robertson and other folks at the city were starting to think about, okay, there's the building, but then what's the ecosystem around these folks? What is the community around these folks that is thinking about food security, is thinking about integration into the community, that is going to have the trust, the relationship necessary? Michael, you talked about it, the kindness at the core, that also knows how to interface with the technical and sometimes bureaucratic reality of a hospital or a clinical institution. And so this idea of navigators who have enough credibility to interface with the hospital, but have equal credibility in community, have the depth and validity of relationship with these folks that can be real champions. That to me is the magic sauce beyond the 51 units.
I think in addition to that part of the magic sauce, and you both mentioned is the intentionality of this entire endeavor. There's intentionality of policy, intentionality of purpose from UHN. What motivated, I think, Fred Victor in terms of the RHI component, because we applied through that process, was that marriage of health and community. And you talk about community navigators or health navigators, that aspect of the work with the communities that we have served for over 130 years in the downtown east, we know that is the magic sauce that has to take place. And we've been cobbling together that for years and years and years at Queen and Jarvis or any other housing that we may have. And this opportunity came up and said, here's the intentionality of this. This is all coming together here in this one project. And we can't let that pass by. This is exactly what we've been advocating for years and years and years. And here we go. Let's get in there. And the other piece of this, and we've touched on it a bit, we have health services, we have Fred Victor's staff and Nation and the support from United Way around food, is the neighborhood itself. That was an amazing experience. I know we might touch on this later, but I've never experienced a more welcoming neighborhood in Parkdale, on Dunn Avenue itself, where this housing, it was the exact opposite of many other places where we open programs, where people were challenging us to say, well, what more can you do?
Mm.
It's not, we love having this here, and it's an amazing looking building, but we want this to be a neighborhood hub. We want to be volunteering in here. We want to see not only the 51 tenants thrive in this environment, but this neighborhood to thrive because of this building and because of this project. And that was like incredible, and that will take time. We have to we have been settling in, developing our operational relationship with Andrew's team, and ensuring that we fulfill our obligations to the city and to United Way as well. But at the same time, is really exploring in a positive and creative manner how the community, the neighbors, will work with us to support the tenants that are there. An amazing example, and I know Andrew's used this before, I think there are neighborhood garden plots, and the gardening group there have reserved for this coming spring, I think, 2 garden plots for tenants in that building. So it's
That's so cool.
from a tangible piece, that's amazing, and it goes to building trust. If I have trust in the staff, I have trust in the healthcare I'm receiving and the housing support I'm receiving, I have trust of tenancy in this building, and I'm also having trust in the neighborhood that is welcoming me. That goes such a long way.
You're absolutely right, Keith. I think that the importance of that often underappreciated social infrastructure that are in neighborhoods.
Yeah.
You think of West Neighborhood House, you think of the work that Fred Victor does, those long-standing organizations that have built the relationships and are there to help to shape the right conditions for those folks to come in, and to try to build bridges across the different dynamics within that community to ensure that those 51 residents are stepping into a place that says you're welcomed here, you're safe here.
Exactly.
It's so cool. And so Dunn House opened up in, what was it, September, October? November. So open up in November. What have you seen so far, Keith and Andrew? What are you hearing from staff? What have you taught, like clients? What has the response been so far?
I think just generally the staff are incredibly excited about it. This is an opportunity to do exactly what we've been talking about for the past little while, of building trust, of building a community, but not in a way that's top down. I have to admit, from a community agency perspective, we're brimming with ideas, but we also have to temper that by saying, you're a facilitator with the community that's living there. They determine what are the activities that are amazing and what can work for them. So be open around that, and not have the hubris. And we learn this quickly when we work in this line of work. The hubris is saying, well, this is what we could do, as opposed to sit, listen, and help people figure out what they want to do, and determine that pathway for them. So it'll take time, for sure, but there's a great excitement from staff, and working with Andrew's team is absolutely amazing, and working in that neighborhood. And I hear that from the tenants as well. A few of the tenants there that I've met with, that there's great excitement there. This speaks to, I think Andrew and Nation may have made this earlier around, there's only 51 units and there's such a demand out there. So the equity is never going to be perfect equity around access there. And there's always going to be, how do we do more? And I know we all want to have this as a replicatable program, or a replicatable project that can be, with tweaks, replicated across the city of Toronto. And we need 10 to 20 more Dunns to actually make a big difference.
I mean, I would agree. And again, I think this goes to scale. And I am hopeful that, again, having conversations like this, which we appreciate, on your podcast, about trying to see more opportunities for, different partnerships like this. It's not all going to be, one land transit. It'll look different. It's going to be hospitals alone, and we know of many, community health organizations who've been doing work like this, wanting to do more work like this, to scale this, knowing, to Keith's point about the needs. I mean, I said this before it opened, and, coming out of it again yesterday, it is really the honor of my lifetime to be a physician at Dunn House. The stories that I've been able to hear, where you're trying to help, and really the sense of, I feel like I'm working at home. It doesn't feel like a clinic space. And it's really, I just have never had that kind of clinical experience, knowing, to your point about this 5-year journey, to have this, to build this housing, to see people have it as homes, and then to be providing clinical care right there, continues to be an emotional journey. And I will say, one thing, and this is not my story, but, to your point around, what has the reaction been? I was giving a lecture at the Rotman School just a few weeks ago, and during the conversation, got interrupted around where, and powerfully interrupted by a clinician who's there who had not, ever worked with clinically, but had said, 2 of my patients had moved into Dunn House, and one of them had not spoken with their family for many years, with their kids for over 10 years. They've now reconnected with their children since moving into Dunn House, and really want to thank the partnership for this, because again, we said disclosure, we've never corresponded about these patients or had this, but since you're here, I think it's important to put out there about what that kind of impact can look like. And it goes back, I think, full circle to a conversation around family or connection or whatever that needs to look like. It may not have to be, family all the time, but what that sense of meaning and health and well-being, back to Keith's point, is going to be defined by the tenants, by the patients, around what that trajectory needs to look like for them and how they want to set that. And I think those are the things where, every week we're hearing more and more of these stories. But again, I think the other part, which I just have to always be painstaking about, is there's also the sense, where you write a prescription for housing, and then you can ameliorate all these things from complex diabetes to issues around cancer to really challenging and end-stage organ dysfunction. The realities are that people have been denied and marginalized housing for 20 to 30 years. They have been in the pathologies of poverty. These changes are not going to happen overnight, but really it's about offering and being able to build together a pathway for them over the next year, 2 years, and 3 years. The other piece that also be open is some people may be palliative, and to be able to have a place, have a home where they, will have, they're set around, their relationship with the end stage of their life or passing away is determined by them. And I think there's a lot of power in that. And so this really, I think, to push is not just about the system savings or the cost avoidance. This is really about the human dignity that can happen at end of life, to some very young patients and clients who are there who want to capture things that brought them meaning before they were unhoused. So I think those parts around this journey really need to be reiterated, because there can be the sense that, there's 10 or 20 more Dunns, and every single one of them is a slam dunk. Every single one of them is going to have its own journey, but I think that's actually the power and beauty of this, and not trying to impose what health and well-being needs to look like.
And I love that the stories matter, and you're changing lives, and you're seeing the impact. But I imagine to scale, you must be measuring a lot of pieces around. Here's how we're going to be able to show you, like a funder saying, okay, show me why this is working, or how, if it is working, and why it matters. And so you could take that and say, and this is why you should do, for all the things you just mentioned. But again, it works, right? It's the numbers that show me this is actually making a difference.
Yeah, I mean, the numbers, and so we have a really fulsome evaluation with partners at Harvard University. We're used to work, it's been great, as well as many local and national experts that we've been looking at this, Michael, from, the patient-reported outcomes, which are really important, like talking about human dignity, to all of the cost avoidance, health system metrics, looking at healthcare utilization from emergency department visits to hospital bed days. There's a fulsome sort of quadruple aim framework that captures all the different dimensions that we see in sort of good health services research, that captures the individual level, but as well as the system level. So I'm with you. I mean, I think these are the realities that when you're out here, there's both the sense on housing being about human dignity, but it's also good health economics. And so we talked about this a bit earlier, that there is really strong evidence and literature for cost avoidance, that it's $14,000 or $13,000 a month in a prison system, $30,000 a month in the hospital, less than $4,000 a month in supportive housing. But I also just want to speak to the fact that we just should be aware that this speaks to the systemic discrimination facing people in poverty. If we're doing all this, we're investing to have really high quality research and evidence as to how this can work, and also work better. It's not ever going to be perfect. It's a journey. But you never say, well, we want to put a new park in Rosedale. Does this save money? Is it cost avoidance? Yeah. You say, no, well, this is a good investment for living in that neighborhood, the dogs in that neighborhood. And, there might be some spillover things you look at, but no one is like, if the park doesn't pay for itself, we don't want it. Right? I want to make sure that I find it's hard pressed on any other policy issue that we're like, if it doesn't pay for itself, we're not interested. And so I just think that we need to be clear, but also when we talk about high quality healthcare, sometimes it necessitates investment. Like you need to spend at high quality healthcare. And what we do in the hospital, what is expensive. And the realities is that people, and this goes back to Nation's point, that have been excluded from the advances of health and science and technology should be receiving those investments and those benefits as they choose. And I think that's the part that we just need to be clear-eyed about. It's not shirking the responsibility of saying we need high quality evaluation or the economics need to stack up. It's just, let's be mindful of where we put that onus on that kind of outcome and on the litany of things that we don't.
I love that too, and you're so right. But I mean, the reality we face so often, right, is that, and you're right, they never would ask that question around a new park, but it's always proving that you're trying to make it, to steal from the United Way, kind of unignorable, right, to the numbers. But incredible work, guys. I want to go to all three of you. What are your hopes for the future? So this is November, it's rolling through, it sounds incredible, great things are happening. And you remain hopeful. What are those hopes? And Nation, we're going to start with you, go to Keith, and end with Andrew.
Well, staying on topic, friends, I continue to be inspired by this work. I think that the world of philanthropy, of which United Way is a part of, and with a hyper focus on being a community impact organization, I think that this is the evolution of what community services can look like, with the integration and partnerships, blending social services with clinical services. I think there's been historically many barriers to that integration. As Keith quite lovely said earlier, this was the perfect combination, and why Fred Victor jumped on it in the way in which they did. So for us, I'm looking for more of these. I'm looking for more opportunities to partner with incredible leaders like Keith, Andrew, the folks at the City of Toronto, Abby, Valessa, the champions who are in community services, who see this as an integral part of the solution, and the ways in which we can mobilize the United Ways and philanthropic dollars to be part of that solution is the future that I'm excited to be a part of.
Okay. I think for us, we're just wrapping up, from a technical standpoint, we're wrapping up our old strategic plan, but launching our new one in June of this year. And it speaks to exactly what Nation and Andrew have been talking about, sort of looking at us as an organization, as a community catalyst for change, for pulling together, whether we lead or we don't lead in the projects, but with a focus on obviously our core businesses around housing and housing supports and the continuum of housing. And I should point out, yes, this is housing, and we talked a little bit about transitional, but for us, the continuum of housing includes shelters as an entry point into housing, and an ability to work with clients and tenants and residents throughout their journey to full housing stability, ideally. So looking forward to the launch of that, but also really hopefully some exciting projects in the future that are housing oriented, that are shelter oriented, but also are health oriented too. We, not to get into a controversial topic, we are part of a heart hub with Region Park Community Health. So we're looking forward to that journey in that, but also challenging, I think, our provincial folks around harm reduction in and of itself as a health issue in the communities that we serve, whether it's downtown east or in the west or what have you, that harm reduction is a critical component as much as food security, as much as housing security. Just this week, as an example, it's a momentous week for us. We actually closed on a purchase through the MIRA program at the city on Monday, a 30-unit building. It's into the Fred Victor family now. And on Friday, we have turnover of phase 2 of another RHI project in Kingston Road in the Scarborough area. And that brings that project up to 84 units once it's finished being tenanted, probably over the next 6 to 8 weeks. So some immediate things that we're working on there.
I think what you said for me on hope as well, I mean, those are, the tangible things. I mean, I think for me, I just think it continues to be these partnerships, but I also just think back on our conversation, like it feels so bleak out there. I have to be honest, let's just be clear about where we're sitting and standing on this time and place, where there seems to feel like there's so much polarization, where I think a few years ago we had this conversation, and I was actually heartened by how quickly we moved on homelessness and the COVID response to keep people from passing away during COVID or being infected. But I think the hard part is once it wasn't about it being about vector control, that optimism, that mobilization, that speed from governments seems to have shifted and changed. And I think we just need to be able to cling on to these, solutions and wins and tangible things around trying to show that we can do it differently. I mean, we did things differently at a time that seems to have been forgotten or been pushed out of sight. And now there are more and more people that don't have these supports. And again, I think 51 units is not going to end this homelessness crisis. But Nathan's point, to Keith's point, there's a formula that can work. And it does require trust. It does require partnerships, but it does require us doing it differently and not being defeatist to say, this is now too big of a problem. We can't do it. It would require way too many investments or initiatives. There are investments out there that if we took a fraction of them, we would make a serious dent in trying to eradicate homelessness. So I just think talking about these different policy choices, it's just really to try, I think, to be heartened by the amazing frontline advocacy and work of people. As Keith mentioned, harm reduction, people are doing this in shelters, trying to keep people alive, casework. And I think we just have to push that privilege of being able to have hope and trying to drive it towards concrete solutions.
Well, I don't see anyone on this call at all throwing their hands up, but you're right. It is pretty bleak. And Nation's heard me talk about this before. And I think we need to take bigger swings as nonprofits and as people doing this work. And remember, too, that in baseball, if you hit 1 out of 3, you're an all-star, right? So not be afraid to miss, and take those swings. And we have to, because we're in crisis, right? We can't afford just to sit back and say someone else will do this. We're going to step up. And I see 3 individuals with organizations that are doing exactly that are saying, if it's going to be, it's up to me. They're doing that. And we're grateful for you. We are at the end of our time, guys, but I do want to say, if people, I want to ask if people want to find out more about Dunn House, just kind of figuring it out or saying, hey, I want to do this in Wales or wherever they want to do it across Canada. How do they find out more? And also just where can they find out more about your organization? Nation, we'll start with you, go to Andrew, and then end with Keith.
Well, we're United Way, greatertoronto.ca. You can look, all of our information is up there. Folks can reach me if they want to have a conversation. The experts around Dunn House specifically are on this call. And I'm happy to share my email address with anybody who wants to reach out to talk about United Way's support in this endeavor. Just one last comment before I sign off. I really appreciate Andrew, Keith, Michael, your comments. And I think this idea that there's an increased vulnerability, and Andrew, if I heard you correctly, like we're weakening out there. One of the things that has been important for United Way in the last 2 years is to really take a focus and say, how do we put ownership in the hands of not-for-profits so they can take those swings, Michael? I think it's easier to take the swings when you feel you've got a stable foundation. And so rallying philanthropy to support the not-for-profit sector to actually own their spaces is a critical part of the solution, so they can take those swings and be seen as part of the solution that accesses rapid housing initiatives and all the government levers to make housing a not-for-profit issue and take the hands out of not expect the market to drive the solution.
Yeah, I mean, one thing I would say too, and to follow, I'm the privilege of working as the executive director of the Gattuso Center, and I think the Gattuso Foundation, and being able to see, identify, and believe in this work before COVID and what had been illuminated or brought to light. You know, again, I think the role of philanthropy with the public and private sector is crucial and wouldn't have happened without that kind of support and vision. And I think, again, whether people want to reach out directly, of course, to Keith and I around Dunn House, I think really this is a marriage around trying to deliver the services, of course. And I think, again, at uhn.ca is the website. My email is andrewbazar@uhn.ca, and really happy to sort of think how we can be helpful as others may want to look at similar models or, try to throw things off that they may have ideas that can work in their local context.
Great. And similar to at Fred Victor, it's fredvictor.org, O-R-G. Information on all what Fred Victor does across the city of Toronto, including Dunn House, is there. Probably my contact information is there as well. And echoing just, Nation, what you were saying is the capacity of the nonprofit sector to make effective change and permanent change. And I think you so eloquently put was that we as a sector need to be on solid footing, or reasonably solid footing, to take the big swings, and as opposed to the market trying to correct something. If it were the market correcting something, we wouldn't be here. It would have been corrected years ago. So we are a vital and important sector to make this happen.
And also, I'm inspired, guys, by a lot of, we're, you're all much younger than I am, but, there's a lot of young people, there's a lot of young people out there that work with that are just, I think that's inspiration, that they really give it, they really care and are really pissed off and really want to do something and are working. So, and they're really smart. So I think, we're in good hands. Things are going to happen. We just got to give them the tools to do the job and get out of their way. Thank you so much. You're three incredibly busy people. I'm going to have you back for the podcast. I think that, we'll title it "Is Transitional Housing Bullshit?" And we'll go through it, right? But that's a different topic for a different day.
I'll opt out of that one.
I'm kidding, of course. I love it. But I so appreciate all of you. And this work is incredible. I think it needs to be scaled. It's life-changing. And I know it was not easy to bring to reality. So thank you for your hard work. Thanks for taking time out of the day today.
You're listening to On the Way Home with your host, Michael Braithwaite.